This is how to do a clinical examination. So the first part is what we call the handshake. So before you start the actual hands-on examination and after the hands-off exam, you just do the handshake. And this is a way of introducing yourself to the patient and the patient to you. So I just take my hands and I run it all over the patient. I feel for any lumps or bumps. At the same time, you can assess the body condition score, the muscle condition score, the coat quality, and also some part of the hydration status. So with the clinical examination, we prefer to have a very systematic approach so that you do your clinical exam in the same order and in the same way every time. We teach you how to do it from a nose to tail clinical exam, but you can develop your own style, what you prefer and what will work for you. So I prefer to start with the head. So first I look at my patient right from the front, assess that the face is symmetrical, pupils are in the right place, there's no nystagmus, no strabismus, pupils are equal sized. See if there's any pain or asymmetry on palpation of the face. Check for any nasal discharges, any depigmentation of the nose. Check the mouth. I make sure that I check all the teeth, and I do it on both sides. And then I perform a CRT, and it should return within 1 to 2 seconds. So after examining the mucous membranes and the teeth, I gently open the mouth, look inside the mouth, look at the hard palate, try and look under the tongue. Thereafter I look at the eyes and the mucous membranes of the eyes. So what I do is I gently press down on the eyeball and lower the lid, and you can see the third eyelid coming up. You can check the conjunctiva, check the sclera, make sure there's no ocular discharges, and you do it on both sides. Okay. After that, I'll go into the ears. I smell each ear, check for any discharges, any swelling, and you do that on both sides. Moving back, palpate the salivary glands, which are the big soft gland at the angle of the jaw. If you move your fingers a little bit forward, you can feel the submandibular lymph node, which is a pea-sized lymph node. So palpate on the other side. Palpate the larynx area for any masses or any pain or swelling. So when we move backward, we look at the neck. So also palpate for symmetry, any pain in the muscles or swelling. Palpate this area of the jugular groove. The jugular groove runs in this area. And you can see there where the hair kind of forms this little row. See if there's any jugular pulses or jugular distension. Palpate for any masses along the jugular groove. I sometimes give it a slight squeeze. So normally a dog shouldn't cough when you give it a squeeze. If there's any sensitivity, they might cough. Then I gently move the neck upwards. So one hand to support the neck, one under the jaw, and then down. Gently to the side. And gently to the other side. So normally a dog should have full range of motion without you having to force it. Moving my way down, I'll palpate the prescapular lymph nodes. Afterwards you palpate the prescapular lymph node, so it's in the area where the neck meets the shoulder. You form your fingers in this way, go in and slide out. And then you can feel the lymph nodes slipping between your fingers as you come out. You can actually see it in that area slipping. When you're finished with that, palpate both front legs, all the way down to the paws. Check between the toes. Feel each nail. Turn it around. Check the palmar surface of the foot. And back up. And you palpate for any pain, any swelling, and you look for any discharges, and you would do it with both sides. Another area that you can palpate the lymph node if it is enlarged is the axillary area. So just put your hand in underneath in the axilla area and feel if you can palpate the lymph node. It's not normally palpable, only when it is enlarged. The next step is to do your thoracic auscultation. So if you can, start with your pulmonary auscultation. Because your lung sounds are a lot softer than what your heart is, so it's easier to start out with your lung sounds. You should be able to hear most of your lung sounds over the area of the mainstem bronchi, which is in about this area, but you need to auscultate the whole lung field. When using your stethoscope for auscultation, make sure that your earpieces are pointing forwards in your ears. Start by listening for lung sounds over the mainstem bronchi and listen for 2 to 3 breaths in each side. Make sure that you auscultate the whole lung field. And you repeat that on both sides and several sides. With cardiac auscultation, the important starting point is to find the point of maximum intensity, and that's usually over your 5th intercostal space. So you can either count your rib spaces, or what you can sometimes do is pick up the elbow, flex it, and see where the elbow point ends, and that's usually your point of maximum intensity, where that would be. You need to make sure that you auscultate all the separate valves, so your mitral, aortic, pulmonary, and tricuspid valves, and you need to know where, over which intercostal spaces you would find them. So your mitral valve is usually the point where you would start, because that's at the point of maximum intensity over the 5th intercostal space. Then your aortic valve is over the 4th intercostal space, and your pulmonary is over the 3rd. And when you do that, your auscultation, make sure that while auscultating, you listen to your heart beat, but you also palpate your femoral pulse. And you make sure that there's a pulse for every beat and a beat for every pulse. Thereafter, after auscultating all the separate valves, you move around the sternum area, and then you go up to the tricuspid valve on your right-hand side. So when you finish with your auscultation, make sure that you do auscultate the tricuspid on the right side. And in that way, you have a systematic approach listening to the whole of the heart and every single heart valve. After your lung and heart auscultation, you move on to your abdominal palpation. It's important that you do it in a systematic way, so always try and do it in the same way, so you familiarize yourself with which organs are located in which area. I prefer to do it with 2 hands, with one hand going between the 2 legs and my left hand to the side of the body wall. You need to start palpating firmly but gently to make the dog used to your palpation. I usually start dorsally and cranially, try and getting my fingers under the ribs, and then I palpate inwards. And I just do it slowly and gently. So cranially, you should be able to feel the liver if it's enlarged and the spleen if it's enlarged. If the stomach is distended, you might be able to feel it. In dogs, you don't often feel the kidneys, but in cats, you might feel the kidneys in the cranial dorsal area. So I'll palpate from dorsocranially to cranioventrally. And then I'll move my hands back in the same way. And I make sure that as I move my hands down, that I can feel the small intestine and the colon slipping between my fingers. So in the mid-abdomen, you should be able to feel your intestines, and you need to make sure that you can palpate every single intestinal loop as it slips between your fingers. Caudally, you can palpate the bladder. In females, if the uterus is enlarged, you might palpate that, and in males, the prostate. If the sublumbar lymph nodes are enlarged, you might be able to palpate that on your caudo-dorsally, your palpation there. After abdominal palpation, we palpate the spine. So I like to palpate every intervertebral space. So you feel the area between the two spinous processes, and in between them is where your intervertebral space is. So I put gentle, firm pressure downwards and feel for any pain or resistance. At the same time, I put my one hand on the abdomen to see if there's any abdominal tensing over an area of pain. After that, I'll palpate the epiaxial muscles, see if there's any pain, swelling, or spasms in that area, again with my hand on the abdominal wall for any contraction. If you haven't done so already, I'll also assess your muscle and body condition score at this point. So palpate the ribs. It should be easily palpable without applying foam pressure. You should have an abdominal tuck. And when you look from the top, you should have a nice indent in a waistline. And that is a good body condition score. After finishing your abdominal palpation, I feel the femoral pulse. So move your hand in this way, up in the inguinal area, and push it flush against the medial thigh. And you can feel the pulse quite easily there. You need to count your heart rate on the pulse. Also assess your pulse quality and strength. Make sure that you palpate the pulses on both sides every time. So I would go on both sides. Make sure they have an equal rate, equal strength and quality. If the inguinal lymph nodes are enlarged, you should be able to feel it in this inguinal area, but they are not normally palpable. After that, you palpate the whole back leg. Any lumps, bumps, pain, swelling. Again, the same as with the front leg. Look between your toes, palpate your nails. Turn the leg around. Look between the interdigital spaces. Make sure there's no swelling or exudate. Palpate your popliteal lymph node. So that should be palpable on normal dogs. To find it, it's at the back of your knee. So here's your patella, straight line back. Also again, form your hands in this way. And you can palpate it by just putting your hands in and slipping it out. So right at the back of the knee. To examine the penis, you need to extrude it. Make sure there are no areas of petechia or ecchymoses or masses. After palpating both hind legs, assess your legs from the back. Make sure that your muscles are symmetrical. There are no signs of atrophy. Palpate the tail. Move it gently. Check for any pain or discomfort or any swellings. Look at the perineum. See the perineal reflex, if that's present. In a female dog, examine the vulva for any discharges or swelling in the mucous membrane color. In males that are intact, make sure that the testes are palpated for symmetry, any masses, pain, swelling, or heat. Then you perform your rectal examination, and on that you feel your anal glands, which is located at 4 o'clock and 8 o'clock. Feel for your fecal consistency, anal tone, if there's any masses or enlarged lymph nodes in the rectal canal, and also the floor of the pelvis for the urethra.